Welcome to Healthier Together, Larimer County's public health podcast, where we come together for healthier lives, connected communities, and real conversations. From your local public health team, I'm your host, Tom.
And I'm Joanna. Every May, we celebrate Healthy and Safe Swimming Week leading up to Memorial Day. Healthy and Safe Swimming Week highlights the roles of swimmers, caregivers, facility owners and operators, and public health officials in preventing disease outbreaks, pool chemical injuries, and drownings. Today, we are joined by Kate Uchitel, Environmental Health Specialist here at the Health Department, here to talk about how the Health Department works to keep public pools safe and steps we can all take to stay safe and healthy this summer. Kate, thank you so much for joining us.
Thank you for having me here.
To start, can you tell us a bit about your role at the Health Department and the work that you do?
Yes, so I'm an environmental health specialist lead within our water quality program. I'm a lead for our aquatics program, which include semi-public and public pools. And we facilitate inspections depending on whether a pool is operating year-round or seasonally. Year-round, we'll typically go out for inspections twice a year. If it's a seasonally operating pool, we'll only go out once. And that is excluding follow-ups if there are any things that need to be taken a look at, maybe a second time.
How does public health show up in recreational water facilities? What are we concerned with when we go and inspect a facility?
We are concerned with kind of a handful of items. Our goals are preventing drowning, illnesses, slips and falls, chemical hazards. Those are the big ones. We operate both as a regulator and we try hard to be an educator as well. That's primarily our focus. On site, we typically meet with the operator if they're available and discuss kind of what they're seeing, if there's any help that they need, and discuss what we're looking at and kind of how things have changed since the last inspection. So we are trying to really focus on operator education so that way they know the risks affiliated with the pools that they're operating.
So what kind of facilities do you guys actually inspect?
So we inspect any public or semi-public pool, which can range from the gyms and hotels to your community pools, anywhere that really has either a membership component or that you can kind of buy an access to. So really wherever you can kind of get your way into,
Gotcha.
excluding the pool in your very backyard.
I was going to say, it's not anybody's backyard that you're actually going and inspecting. It's, hey, you have to have access to this through a membership or it's open to the public. And I'm assuming that this does not cover like open bodies of water, like Horseshoe for the reservoir, where it's like, hey, or somebody's lake.
Yeah, we don't have any program for natural bodies of water.
So walk me through an inspection. What does it look like when you start and kind of all the way through the end? I'm curious what you guys are looking for.
So right before we start, we always take a look at the history beforehand. And especially if we know, sometimes we'll go in with the knowledge of like, hey, we know that these guys have had an issue with either like a chemical or maybe a barrier, but we'll go in before we even get to the pool side. We'll take a look at the gates, the enclosure, making sure that everything is kind of separated and that the gates can close, and make sure that no kids can kind of just run on in and jump in the pool without really trying to. And then from there, we'll take a look at signage, making sure that there's no diving signs if applicable, how deep the water is, and take a look at the water chemistry as well. And then from there, we will go into the pump room to take a look at where the chemicals are stored and also take a look at how the system is flowing to make sure that they have feeders and all the necessary equipment that we look for.
Well, that sounds pretty comprehensive. You know, I did want to ask, though, it sounds like there's been some changes with regards to the health codes for these kind of facilities. My understanding is that that's part of the MAC, that Model Aquatic Health Code that we've all been talking about in the department. Can you tell us a little bit about the history of like the pool inspections that we've been doing and what's really changing?
Yes. So when I first came here, there was an intern that did inspections of public pools before we even had a program.
Oh.
And from her research, it was widely found out that we needed to have a program. And from there, we started with the Colorado baths regulations that we have currently at the state level. based on drinking regulations back, I think, in the 90s. So the information that we've been working with for the last 5 or so years has been not the most effective that we would look for.
Mm,
So in the last couple of years, we've been focusing on changing over to CDC's Model Aquatic Health Code, the MAC that you referenced. And we have finally included that into our very own regulations for Larimer County Aquatic Health Regulations as of January 1st,
what
2026.
are some of the bigger changes that you see in the Mac that we're now starting to incorporate that we didn't previously?
Yeah, so one of the big things, the biggest thing I would say is transition over to a minimum chlorine level. The previous one was, I believe, point 0.4 free chlorine, and it's 2 now.
Hmm,
So point 0.4 was based on drinking water standards, not the most effective for treating water-based diseases and
gotcha.
bacteria.
So I am curious, and I'm sure some of our listeners are. Right now, we have retail food establishment inspection reports that are available online. So somebody could look at and say, "Oh, okay, this restaurant, yeah, they passed. Great." Is there anything like that for pools?
Yeah, actually, on the very same page that you would look up those restaurant inspections, you can take a look at pool inspections too. There's a tab over on the side that you can click what program it focuses on, and you just switch that over to pools and you type in either a pool you want to look at, or if you just want to look at the most recent inspections, you can leave it blank, click the search button, and they'll all pop up.
Gotcha. So, I mean, but when you walk into a pool, it's not like and this might change over time. They don't have like a permit that's prominently displayed like we do in our restaurants. Like there's nothing on site that somebody could go, "Oh, yeah, they passed their most recent inspection."
Yes,
Okay.
we don't have anything like that at this time. One of the regulation requirements in the MAC and what we'll be looking for is that they have a posted last inspection
Oh,
results,
okay.
but that is something that we are still working on kind of internally, how they can go about uh, hanging that up, whether they need to post each individual one or if we'll have like a QR code to make it easier on them for their patrons just to quickly look it up.
Gotcha.
What diseases are most commonly spread through public pools?
The top one I would say is Cryptosporidium, which is a gastrointestinal disease that can, well, will give you diarrhea and just digestive upset. It is resistant. It's very chlorine resistant, so you have to have that minimum chlorine levels for a certain amount of time in order to treat it. So anytime that there is an incident, a diarrheal incident, it should be treated with high levels of disinfectant for X amount of time, depending on what those levels are. There are concerns about like E. coli, Giardia, swimmer's ear. Hot tubs are known for folliculitis, which is just a hot tub rash. A lot of times with those bacteria will hang out in like a biomat, essentially, and that just kind of has to be scrubbed in addition to that chlorine or that disinfectant that's being treated as well.
Are there steps that people visiting public pools can take to help prevent the spread of those diseases?
Yeah, so the biggest one I would say, it's not fun, but if you or your kiddo has any symptoms of illness like diarrhea or vomiting, to stay out of the water for at least 24 to 48 hours till those symptoms disappear. Because, especially with diarrhea, it can affect the whole pool really quickly and it's a long process to treat.
And then, what are some common safety hazards associated with pools and other aquatic facilities that people should be aware of this summer?
There are a handful. So, one of the things that we're taking a look at is the main drain, and it should have a grate on it. Depending on where it's located, it'll have to be elevated. But the biggest thing that we're looking for the grate is making sure that it's not an entrapment hazard. It could potentially entrap somebody and drown them, potentially suction them in. That we have had recent drownings in the US. I think there were at least 2 last year. But yeah, that's one of the things that we're looking at. And then preventing drownings. One thing to think about would just be the color of clothes that you're wearing to the pool. And you want something that contrasts the bottom of the pool in case there is anybody who's been down there for longer than they should be.
So, what steps can facility operators take to mitigate some of these hazards? You mentioned that there's the main drain. Is there anything they should be paying attention with regards to that?
Yeah, so the main drain actually is a federal regulation. That's
Oh,
something that everybody should be doing already, but that's based on the Virginia Graham Baker Act, which unfortunately took a young girl's life because she got sucked in and trapped and drowned. One of the things is that in addition to it being a certain type of main drain cover, it does have to be replaced typically every 5 to 10 years, depending on the brand, but making sure that you have information about that and making sure you're up to date on that. So that way you don't have that hazard. You're taking a proactive approach.
do you have any tips for private pool owners on how they can keep themselves and the swimmers at their pools healthy this summer?
Yeah, I would say keep an eye out on the disinfection. Keep your chlorine at least at 1 part per million. And in addition to that, always keep an eye on your kids. Drownings can happen really quickly, and it's usually preventable.
So, where can listeners go to learn more about staying healthy and safe while swimming?
So, one of the things that we've been working on is our website. There's a lot of information there about our current regulations and the different options available. And so, preemptive options in preventing illness and hazards affiliated with recreational waters. Another great site is the CDC at Healthy Swimming. The CDC is actually what put together the Model Aquatic Health Code, which is frequently, I think every few years or so, revisited. So, in addition to looking at the MAC, you can also take a look at the CDC's website. There's a lot of information there about healthy swimming and preventing illness and hazards.
Perfect. Kate, thank you so much for joining us. We really appreciate you taking the time.
Yes, thank you for having me here.
Do you have a question about public health in Larimer County or a topic you'd like us to discuss? Let us know. Email us at healthiertogether@larimer.org. Thanks for listening, Larimer County.
Until next time, stay well, stay connected, and remember, we really are healthier together.